Welcome to Collegial Conversations with your host, President of Intent Clinical, Diana Clark.
Hi, and welcome to Collegial Conversations. Today we're talking to Teri Bryant, a seasoned, experienced, and very widely known marriage and family therapist. She works at a local treatment program, really working with families who have difficult journeys along the way. And today we're talking about a modality called open dialogue, one she is a big fan of and one I frankly want to learn a little bit more about. So thank you, Teri, for joining us today.
Yeah,
Welcome.
thank you for having me, Diane. I'm very happy to be here.
So open dialogue, is this a relatively new formulation of marriage and family therapy, or has it been part of it and just in recent years been discussed as a modality?
Yes, I think open dialogue actually was created in the 1980s in Western Lapland, Finland, and it was brought, I believe, to the United States by Mary Olson, who had traveled to Finland and had done some training there. And Mary was a professor at Smith College. Not quite sure if she's there anymore, so I apologize if I don't have her full history, but she's a wonderful human. Continues to teach open dialogue in the United States, was my teacher, along with really Jaakko Seikola and people from Finn who would fly over and teach us this method. And it is a form of family therapy. It's born out of family therapy, I believe. There's a lot of um, uh, components of open dialogue that I was trained in as a family therapist. But it really is a network approach to treatment. It created in Finland in the 1980s. The idea is that all voices are heard and given value. And so you're meeting with, they use sort of the term the person in the center of concern and anyone in their network who is important to them. And you start with network meetings, and you really try to keep everything around decision making around treatment inside of those meetings. So it becomes more of not doing to, but doing with. So they use the word withness a lot, with open dialogue. Yeah.
And when these network meetings are happening, whether they're in a treatment program or without a treatment program, when we're talking about witness, is it usually focused on the person of concern, or are they broader subject matters?
Yes. So the focus is not on the person of in the center of concern. It is about the whole network. That's what it means. Like when we walk in the room, it's about all of us. It is not a monologue, but more
Mhm,
so what they call a polyphony. So all voices are heard and valued.
mhm.
And there's generally two clinicians in the room. But what you're trying to do is not create sort of like this space where you're the expert, but more you're a person that's there, that's curious, that wants to understand what's happening. So it's not about what's wrong, but what's happening in this network, what has happened.
So it's more of a facilitation of a chorus than it is a consulting, "This is what's going wrong, here's what you need to do next,"
Yeah,
or "You do talk about this."
yeah,
It's
yeah, yeah.
it's way more of a facilitation.
Yes, yeah, kind of like jazz.
Jazz.
Yeah.
And in that, is there usually a set agenda coming into an open dialogue session, or is the agenda set in the meeting?
That's a great question. The agenda is generally set in the meeting. So in the very, very first meeting in open dialogue, you really want to just check. about like what the idea is of why we're all in the room. So it's really like gathering the history of the meeting. Why are we here? And instead of like focusing on the person in the center of the concern, like what happened to you? What's brought you in here? It's more about asking every person in the room, what's your idea of why we're here? And really listening to what they all have to say. And that's usually in the very first meeting, is gathering the history. Like, why are we here?
So that's really interesting. In my years of experience doing, the swoop in Johnson method
Yeah.
intervention
Yes.
many years ago,
Yes. Yeah.
the initial pre-intervention meeting was often led with that very question, why are you here? But I would imagine that what follows that question is very different in an open dialogue setting than in a traditional interview.
Yeah. 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 I mean, it's a real true beginning of dialogue. Like really trying to give voice to all people in the room. Um, and it's interesting to hear their perspective, which can be very different from one another. Um, and most meetings start out like that, but the question may be, what would make this a good meeting for you? If you were to leave this room after an hour, what do you hope to walk away with? What would have been helpful?
So in any conversation, there are pieces of open dialogue that we can use, I would imagine, in any conversation in our lives or in any group process, trying to accomplish something, trying to move. What would those pieces look like? I love what you just said. What would a successful meeting look like? What would a meeting where you felt heard sound like? Those kinds of questions. What are some others that you could imagine that people could take away?
Other questions or
Mm. Yeah. That would occur in the course of an open dialogue meeting, network meeting that the rest of us could use anytime. What are some of those? I know they're probably pretty simple and
yeah.
we probably use them, but to understand why we use them would be a good thing. Yeah.
Yeah, so the interesting thing about like there not being any agenda is there's also not a set of questions that you ask in
Mm,
open dialogue meetings. So you
okay.
really are working off what you're hearing in the meeting. There's always two clinicians, like I said, and at some point during the meeting, we pause with permission, right? Is it okay if we take a break right now? And the clinicians in the room turn and look at each other and reflect. And there's 4 reflection modes. You wanna think about, like, did something resonate with you? Did an image come up for you? Um, what did you notice, right? And when you're reflecting, the clinicians are reflecting with each other, those are the things we're saying. And it's very spontaneous, there's no script. It could be something like, "I noticed when mom started crying that she folded her hands in prayer." That's a reflection. Reflections are very, um, they should be very short. They shouldn't be dissertations. They should not be formulaic. You should not be formulating what's going on with the family. That's not what you're doing. You're just noticing. You're listening. And so there's a quick interaction between the two therapists in the room. And then we come back to the family and say, was there something about what you heard us say that you wanna reflect on? Were we wrong? Like, do you disagree? Do you agree? And you ask every single person in the room because you wanna make sure you're bringing all the voices and hearing their perspective.
That's great.
And that's the back and forth in the session.
Mhm. Mhm. So, but I like even just the reflection piece.
Yeah.
I'm noticing
Mhm.
that, your fists are clenched tight. What what does that mean for you? Yeah.
Right, right. Or yeah, just noticing. right?
Just know.
It's a lovely way for people to be seen and heard.
Mhm.
And, we don't know sort of like where these families like have been, um, how they've been directed, how they have possibly been judged because of thoughts or feelings that they have. We really, so I think we have to be mindful of that.
Absolutely.
Yeah.
Absolutely. And I think that in a culture that is moving so fast with so much attenuation using screens, using phones, whatever, the idea of being present, we've lost some of that skill
Yeah.
of just being present. If somebody has a question, somebody else wants to answer it immediately on their phone. The idea of just being present with uncertainty and question is really, a skill that we're losing
Right.
as
Right.
a culture.
Yeah. What the beauty of open dialogue is that I think many people who are coming in, and this is a method that works with lots of presenting issues, right? But it's particularly really good for people who have the experience of psychosis, and and it really is creating a space where we're not putting a clinical gaze on someone and diagnosing and like blunting out with medicine, right? Like all those things are important, but when you're in this particular space, right? Like
And then
yeah, you don't want to have a clinical gaze on any particular person in the room, right? And I've heard people say things like I had a mom say to me once, like, the past two places we went with our son, I felt so judged. And this is the really first place that I felt like someone really listened to me in this room.
and maybe not just in a clinical setting. I would imagine that there's many people who come into a room like that who feel like it's the first time they've ever been listened to.
Yeah, yeah.
Ever.
Yes. Yeah, yes. Or not judged or yeah,
That's
blamed.
beau that's beautiful. And if outside of a treatment center, if you were a family, a general family, and you thought, I would really like to engage in this process. Is there a way to find open dialogue clinicians? Is this a common enough practice or is this burgeoning in our country?
Yes, it's not common enough practice. I think it is burgeoning. I believe like um for some families, they are lucky enough to have the means to be able to pay for private therapy, but like a lot of insurance companies don't recognize or cover open
No, I wouldn't imagine
yeah, as
because of
far as I'm
therapy,
right, that's right, that's right.
right?
But there are some, uh, like, private practitioners that will engage in open dialogue. So if someone I obviously have a full-time job as director of family services with Ellenhorn, but I also have a small private practice, and if someone approaches me for open dialogue, I will seek out one of my colleagues that I know is also trained and will work with the family.
Great.
Yeah.
So, what has open dialogue taught you that surprised you the most?
Yeah. That I when I was training as a family therapist, I was getting all sort of like excited about which style of family therapy I liked the most or which theorist was my favorite, right? And um, when I got trained in open dialogue about 12 years ago, I really had to leave that expert person at the door. Right. And so it was a big paradigm shift for me. Like, because you're so used to sort of like, "Oh, you have to have better boundaries than that," or, "You need to put dad in that chair and mom in that chair," and, like, really just sort of this idea of being with was so lovely, but awkward for me, like, in the beginning. I had to retrain my brain,
Right?
but I have seen so many wonderful, wonderful, healing moments in open dialogue that it's a beautiful thing.
Being with. I know that when my dad, who struggled with bipolar disorder, was having a very difficult time, and I said, "When's the hardest time for you?" And he said, "In the middle of the night." And I said,
Yeah.
"Well, why don't you call me?" And he said, It's the middle of the night, and what are you gonna do? And I said, "Nothing, but you won't be alone with it, and I will listen."
Yeah. Yeah.
But it was taking off the, "What are you gonna do?" In those meetings, there isn't a you doing, there is a you creating space, containing, is that right?
Yes. Yes. Yeah. Yeah. And I think like just being able to sit in silence, often there's many moments in open dialogue meetings where there's silence. And there's a lot of words in silence, and it's sometimes just being with a person like you were with your dad on the phone, right? You may have just been on the other line listening, right? Or maybe the two of you were saying nothing, right? Right. It's such a gift. Um, Another big aspect of open dialogue is also there's a lot of fidelity measures in open dialogue, but sitting or tolerating uncertainty. So sort of trying to just be in that moment without freaking out or without like having to formulate or argue with the person about what they're experiencing, right? Because that's real to them, right? So there's a lot of wonderful components.
Beautiful.
Yeah. Yeah.
What haven't I asked you today as we close up that you would like people to know about this?
I think um, this idea of not judging and listening and really resisting the need to fix, right? Like I think families in particular and therapists too tend to get into these fix it modes, like they feel like it's their responsibility to help and fix. And one thing I learned from open dialogue is this idea of like asking permission, being curious, right? And so this crosses over into other family work because I do a lot of family work with people who aren't doing open dialogue, right? Or couples work, right? And I think a really important thing is um, the questions like, is this a place where you wanted me to give you advice? Or is this just a place where you want to be heard? And I'm trying to teach that to families all the time. Right?
Right.
Like, ask your
Um,
loved one this question.
what do you want?
Right.
Yeah,
Is this, do you, because is that idea of fixing that a lot of family members and loved ones and network people jump into and think that they have to. And maybe they just don't, right? Give yourself permission not to. Yeah.
that's right.
So it's
I
been a
love it.
big takeaway for me in my own family too.
I'm gonna leave everybody with a quote. I'm gonna quote Henri Nouwen, who was a monk and lived in Canada. And one of his quotes, he was a prolific writer about spirituality, but the quote is, "The friend who can be silent with us in a moment of despair or confusion, who can stay with us in an hour of grief and bereavement, who can tolerate not knowing, not healing, not curing, that is the friend who cares." And that sounds like it would be such a lovely, lovely message about open dialogue as well, just
Yeah.
being listening, not
Yes.
fixed.
Yeah. Yeah. Lovely. Yeah.
Yeah.
Thank you for
Well, you're welcome. Thank you for joining me today. And for you watchers, listeners, if you like this, please do so on your platform of YouTube and put that thumbs up. We'd appreciate it.
thanks for having me, Diana.
Thank you, Terry.